This audio series reflects footage recorded from a Meet the Expert series hosted by Nai Disha Resource Center with Dr. Padma on autism management techniques. Dr. Padma is a psychiatrist based out of Hyderabad who has experience working with children diagnosed with autism and/or ADHD. For more information about autism, please visit www.nai-disha.org. Nai Disha Resource Center serves to provide essential information to families of individuals with intellectual and developmental disabilities. It also provides assistance finding service providers and offer peer group support and interaction. Topic discussed in this audio clip. Let's talk about the importance of early intervention in autism.
If you have a child that's 1 year old, 1.5 year old, maybe even 14 months old, however old the child, if you come to me and you say to me, my child is not making eye contact, my child is not responding to name, my child is not interested in people, it is my job as a provider to tell you that, if I'm sure that your child is going the autism way, I can tell you that, but if I don't have the heart to tell you that, at the very least I should tell you, now is the time to put your child into some kind of intervention. Don't worry about what your child does and does not have, right? Your child definitely has social delays and speech delays. Please go start some therapies. It is my responsibility as a provider to tell you that. The earlier you start, the better off you are. There is no minimum age to start. After 1 year, after the first birthday, anybody that comes to me with delays, it's better to intervene than not to intervene, right? And if you intervene, let's say I'm wrong, the worst I've done is wasted your time and money. If I tell you not to intervene and if I'm wrong, the worst I've done is ruin your child's life, right? And I don't want to take that chance, right? This is not me saying it. This is American Academy of Pediatrics guidelines that were released for practitioners. Intensive intervention, at least 25 hours a week and 12 months a year. Not me saying it. This is again American Academy of Pediatrics saying it. So we know behavioral therapies work, right? But we also know that they don't work if we do it like an hour a week, 2 hours a week. They need to be intensive. Now I understand, I get it that, I'm the first one that understands that we don't have enough therapists, we don't have well-trained therapists in Hyderabad. I get it. Right? So what this translates for you as parents is it puts a lot of burden on you. If your child is getting 1 hour a week of therapy from a therapist, the rest of those 24 hours fall to you, right? And it falls to you to learn what to do and do it. And it falls to your therapist to teach you what to do. So any therapist who is not willing to engage in teaching you what to do, you're not going to see a whole lot of result out of that, because any intervention to be really effective, it has to be fairly intensive. Low student to teacher ratio, I think we do a pretty good job with that. I think we do a lot of one-to-one intervention in Hyderabad, so I think we're okay there. Family component, parent training. Opportunities for interaction with typically developing peers. So this is what I tell my parents when they come to see me. I tell them putting them in school is good, right? But if you can take your child to interact with other children maybe an hour a day, if it is at all possible, if it is an option. And again, I understand that, a lot of people live in areas where there is no young kids around. I get that, right? But if it is at all possible, it's better if you can take your child every day, a half an hour, 1 hour interaction with other children, because you're there to promote social interaction in the beginning. In the school, especially if you put them in a school where there is like 20, 30 kids in a classroom, your child is basically doing nothing over there. Your child is sitting in a corner and basically not paying any attention to the peers, and nobody is really promoting any interaction, right? So it is preferable for you guys to supervise it or somebody to supervise it and gently encourage it. If you can't do that, school is the next best option. need a routine. They need things to be fairly similar every single day. So they thrive on routine, visual activity. So what they're saying is any setting where the child is getting educated, any setting, whether it's a school, a therapeutic setting, whatever it is, preferably the setting should have routine. Preferably they should have visual reminders like calendars, visual teaching aids, those kinds of things should be there, is what they're trying to say. Right, you guys probably don't know what the term generalization means, but as soon as I explain, everybody's going to go, yes, yes, yes. The child makes eye contact with the therapist, but not outside of therapy. Right? The child will smile back at the therapist, but not outside of therapy. The child is not going to live with the therapist. It is your therapist's responsibility to help you to generalize that skill the child has learned outside of therapeutic setting. It is a goal of therapy. It should be a goal of therapy. So it is not okay if your therapist tells you, and I'm sorry, I don't mean to be nasty to therapists, but it is your therapist's job to make this happen or to help you make this happen. Now, I'm not saying every child will learn every single skill. I'm not saying that it is possible for everybody. We all know that there are some kids who will not learn certain skills. I get that. I'm not saying it's all the therapist's fault. But this is a goal that every therapist should have. I mean, you're not taking your child to therapy because you want them to make eye contact with the therapist, right? You want them to be making eye contact with the world, with the rest of the world, with everybody, right? So this is a goal of therapy. Maybe not in the beginning, but this is a goal of therapy. And what are the things that should be addressed in therapy, in early intervention? Spontaneous communication that is functional. Communication, whether it's verbal, non-verbal, it needs to be spontaneous, meaning it needs to be initiated by the child, and it needs to be functional. It needs to be for some purpose. It can't be the child talking to themselves spontaneously. It has to be communicating with another person. Has to be therapy should focus on joint attention. How many people know what joint attention is? Joint attention is when I say look over there, everybody is looking over there now. That is joint attention. When I ask you to pay attention to something, you're paying attention to it. And why do we need our kids to do it? Because we need our kids to pay attention to things that we ask them to look at, because we want them to learn what we are teaching them. Without joint attention, it's very hard to teach anybody anything. Right? Imitation. Without imitation, it's very hard for your child to learn speech even, or anything. Reciprocal interaction, back and forth interaction, smooth back and forth interaction, verbal and non-verbal. And they should also focus on decreasing maladaptive behaviors like aggressive behaviors, hitting others, pinching, involving in stimming behaviors. All of that should be a focus of your therapist. Right? Getting them ready for school, getting them ready with academic skills, all of this should be focus of early intervention programs. So it is okay to expect your therapist to do all of that. It just made your job very difficult. It is difficult for one therapist to do it. Usually we need a group of therapists to do this. We need a behavior therapist, we need a speech therapist, we need an occupational therapist. In some kids, they also need a physiotherapist. We really need an army of therapists in the beginning to have all of these goals be realized.